For many more than before, the pandemic has become personal in this city. COVID case numbers are rising fast, but another number gives us perspective on the situation and the scale of loss. 75,000 people live in the centre of Carlisle and the suburbs around it. In the last few days, the number of people who've died with COVID in the UK has reached and risen above the population of this city.
He's kind of like a typical old northerner, northern farmer, a bit grumpy, but mostly in a charming kind of way. He cared about the farm, he cared about his children, he cared about his grandchildren, and he's got great-grandchildren. Or he had great-grandchildren, so yeah.
Meredith's father went into hospital with pneumonia a month ago. 2 weeks later, he tested positive for COVID. He was 84 and had the lung condition COPD. His name was John Whitton. He died 4 days ago.
My dad was so close to getting his vaccination. He was so close, and he didn't make it. This could be anybody's father. It could be anybody's grandfather, who had to, be in hospital for so long without seeing his family, and who had to, who passed away by himself, and he was alone, and he didn't have his family there.
The situation across Cumbria is worse now than it was in the spring, after a rapid increase in cases before Christmas. We now know the new variant was spreading earlier and faster in Carlisle than pretty much anywhere else outside the southeast. And the impact of that sudden surge in cases is being felt now, not least in Carlisle's hospital, where they don't have the kind of capacity they do in most big cities. For weeks, pressure's been building at Cumberland Infirmary, and in recent days, some COVID patients have been transferred to Scotland.
We are at a very perilous state, I think, at the moment, in the north of Cumbria in particular.
Colin Cox, the Director of Public Health for Cumbria, told this programme back in June that winter was his big worry. Now, with the case rate higher than ever, inevitably, more people are being told to self-isolate.
For some people, that's easy. For others, it's much more difficult. People on sort of 0 hours contracts, for example, there is national support that's been available. There have been challenges in getting access to that for some people.
And how big a factor do you think that is in transmission?
It's almost certainly a significant factor in transmission. And of course, the irony is that the people who are most vulnerable to coronavirus are the very people who are going to find it most difficult to isolate.
We are really worried about the rising cases and, people having to self-isolate and the amount of redundancies and people losing hours at work. It really is a massive worry for us here.
Deborah's a local councillor in Carlisle. She knows in the city's most deprived areas, for some, lockdown means a choice: compliance or hunger. Along with staff at this community centre and teachers from the school next door, she's doing food drops to families with young children.
I'm hearing many more stories now about younger people dying. There's young children being left behind with parents that are passing away, and that is really, really frightening.
It's not just one of those third-hand cautionary stories people tell. A few streets from here, an electrician called Michael Wilson worked for the local NHS trust. He died with COVID on Saturday. He was 39 and a father of 2. His son is 12. His daughter is 7.
We've been dealing with this for not just weeks, but months now. And it's the constant pressures of infection control, donning and doffing of personal protection equipment. It does take both a physical and emotional toll.
Amid the frustrations and stories of rule breaking, there is a kind of hope in the selfless acts of many every day. Meredith is making plans for her father's funeral while self-isolating. She wanted to talk to us to put a name to one of the numbers and to say thank you.
Obviously, I miss him, but I'm very, very grateful that the day he passed, I was able to speak to him. The nurses picked up the phone for him and put it to his ear, and I was able to say my goodbyes and tell him that we all love him.